Hey guys, how are you? Coming to you from YouTube land. I hope everyone is doing well. Today is going to be my first pharmacy talk video series, and today we're going to talk about the flu. I know here in Houston the flu has been absolutely running rapid. It seems to be more common than the common cold with everything going on. So I'm going to give you guys some information that you need to know about the flu vaccine, and what you can do to prevent the flu. Excuse me, to protect yourself and your family. The information that I'll present to you is not of my own opinion. This is my disclaimer. It's just to give you guys additional information. All of the information that I will share with you can be found on the CDC website. You can Google CDC space flu, and then the information will pop up for you on the CDC website. So let's jump right into this. The flu has been, like I said, going around, and I'll just share some information with you. There are, according to the CDC, there are 4 different strands of the flu that are actively present in this particular flu season. They cannot give us any type of estimation as to how many people will get the flu or how many people will die from the flu. They cannot, it's something that they haven't been able to report each year, because they do say that the flu is a non-reportable disease. So they do expect for it to be an epidemic, not just this year, it was last year as well. So typically it tends to peak between October and November, and October and November is when it starts, and then we see a peak between December and between the dates of December and February, the months, I'm sorry. So during that time, about October, November, you can see it as early as September, the flu vaccine will be available for you. So let's talk about the flu vaccines and get into that. There are different types of vaccines that you can get. There is one that is a nasal spray. It's not one that the CDC really recommends. They haven't recommended it for a long time. They don't believe that it's as effective as the ones that are injected into your muscle. So you have different vaccines that are your simple standard dose flu shots, and then you have high dose flu shots. Then you have flu shots that are made from cell-based technology, and then you have the egg-based flu vaccine that you can get, which is the most popular one that they typically give. They have changed the recommendations for getting the flu shot. It used to be as young as 3 years old, and they have pushed it up, I would say earlier, to be 6 months. 6 months and older, to be consistent with all of the FDA approved labeling that that comes with the flu vaccines. So one of them that is newly available this year is one that fights all 4 of the flu strands, and it's called the Flublok Quadrivalent, RIV. Last year, only the trivalent was available, and that only covered 3 of the strands. So the high dose shots are for typically the older people, the elderly. They do recommend 63 and older, or 65 and older, in order to get the high dose shots. They also recommend the shots grown from cell culture for everyone. So then you have, so you're able to get that. Getting the flu vaccine is the first recommendation they make in order to prevent the flu for you and for your loved ones. When you go to get the flu shot, you can ask, depending on where you go, whether you go to the doctor's office or whether you get it at your local pharmacy, with at Walgreens, CVS, Rite Aid, or when you go to the grocery store, Kroger Pharmacy, Randall's Pharmacy, you can ask them what type of flu vaccine they have. You can ask whether it is egg-based or whether it is the cell-grown vaccine that they do have available. So some people are allergic to eggs, and the recommendations that the CDC makes for that is that if you only experience hives from eggs, then they do approve for you to be able to get the vaccine. People who have symptoms other than hives after exposure to eggs, they it should be given, and they do still recommend that you get it. However, they do also recommend that it's given in a medical setting and be supervised while you get it, so that in the event that you experience anything like prophylaxis, lightheadedness, respiratory distress, that they do have the ability to help you out in that particular situation. And then you no longer have to wait 30 minutes after receiving their vaccine once every if you choose not to. So the very newest thing that has come up is the cell-based vaccines that are available. And what's the big deal about that is that they do not have the changes that are present in the egg-grown reference viruses. They are thought to be more similar to the circulating wild type of virus that is currently out there. And so what makes this different is that if you have a particular flu strand, then the cell-based virus is more apt to help you fight it off than to have your flu symptoms be worse. So, being that the flu is so rampant, what can you do in order to prevent the flu for you and your family? The first thing that's recommended is, of course, to get the flu shot, to get the flu vaccine. The second thing is general cleanliness, making sure that you are washing your hands frequently, that you're using hand sanitizer. It's always a good idea to wash your hands and use hand sanitizer in conjunction with each other. And that way that you know that your hands are thoroughly clean. If you are around people who are ill, do not be afraid to put on gloves or to put on a mask. If you can minimize your contact with people who are already sick, please do so. Then you have, make sure that you're cleaning everything. If you come in contact with someone who is sick, if you have to make a trip to the ER, even if you're not coughing, everyone does not practice good cough etiquette. So they're coughing into the air, they're not coughing into their sleeve or into their elbow, they're coughing in their hand, they're sneezing in their hands. And so you want to make sure that even if you do not have any symptoms, any flu-like symptoms or cold-like symptoms, that you still protect yourself. And don't feel embarrassed or anything about putting on a mask, using gloves, keeping your distance and things like that. Make sure that you sanitize everything. Should your family members become sick or even yourself, make sure that you're washing your linen in hot water. Make sure that you change them frequently using disinfectant. All of those things are important in preventing the flu. Let me make sure that I haven't missed anything. It's always a good idea to make sure that you are educated about the flu. That way that's another preventative step. That way that you know what to expect for the flu season. And so again, with the vaccine, just everyone 6 months of age and older should get the flu vaccine. And then especially if you are at high risk, if you have any type of other illnesses, they do, especially if you have any antiviral illnesses, then they want you to make sure that you do indeed, if you have any immune issues, then they want to make sure that you do get the flu vaccine. One other group of people that was questionable about getting the flu vaccine are pregnant women. Pregnant women can also get the flu. They do recommend that pregnant women do get the flu vaccine if they are healthy. So unless you have any type of serious flu complications, such as asthma, diabetes, heart and lung disease, and if you are over 65, then they want you to make sure that you are that you do, if you choose to get the flu shot, that you do it in a healthcare setting. Let's see. Make sure that if you do wind up with the flu or you start having flu-like symptoms, that you stay home for at least 24 hours after your fever is gone, just to get medical care and everything like that, just to make sure that you stay on top of it, or rather ahead of it, so that your symptoms won't last as long and they won't be as bad. Again, wash your hands with soap and water. Make sure that you also use alcohol-based hand sanitizer. Cover your mouth, your nose with a tissue when you cough or when you sneeze, and throw the tissue in the trash. Do not throw it on the floor. I have seen grown adults, very grown adults, throw tissue that they've used onto the floor, and I cannot tell you how disgusted that I am with that. You know, you have some children who do better than that. So make sure that you avoid touching your eyes, your nose, and your mouth. Those are the typical, because you do have lubrication in those areas. It is quicker to spread the disease to the rest of your body with touching. I have a very bad habit of touching in my face. So don't be like me. Don't be like Nikki or Ro. In order to don't touch in your face. So make sure that if you do get the flu and they prescribe you any type of drugs, I know that people can be very bad about this. Make sure that you take your medication. The medication will help you. Even if you start to feel better after you take the medication, like 2 to 3 days into it, it is recommended not only by the CDC, but your pharmacist will tell you as well, to continue and finish the entire course of medication that they give to you. Antiviral drugs that they give to you are different from antibiotics, so you have to make sure that you do take everything that they give to you. And the reason for that is that it can make your illness milder and shorten the time that you are sick. And then it can also prevent other serious flu complications. Some people get, if the flu turns into a respiratory infection, it can turn into pneumonia. So you want to make sure that you're taking your medications in order to prevent those things. Again, all of my information that I've shared with you guys today has come from the CDC website. Feel free to go onto their website and learn more, to learn additional information about what they have for the flu, as well as any other thing that you may be curious about. So that's all that I have today for my first video for Pharmacy Talk. If you guys have any questions, post them below. And as always, like the video, subscribe, and share if you found the information to be helpful. And I'll see you guys on the flip side.